A full night's sleep and you still wake up exhausted. The number on the scale keeps climbing even though nothing about your eating has changed. You walk into a room and completely forget why. Most people over 60 chalk all of that up to age. Some of it is, but a surprising amount of it might not be. And the difference is a blood test most doctors don't order unless you ask. The thyroid is a small butterfly-shaped gland sitting at the base of your throat. You almost never feel it, you probably never think about it, and yet it quietly governs the speed of nearly every system in your body, your metabolism, your heart rate, your body temperature, how clearly you think, how deeply you sleep. It is, in the most literal sense, the body's master throttle. When it slows down, everything slows down with it. The condition is called hypothyroidism, an underactive thyroid, and it becomes significantly more common after 60. Some estimates put it at roughly 1 in 5 older women and about 1 in 10 older men. Those are not small numbers, and yet study after study finds that a large share of those people have never been diagnosed because every symptom they are experiencing has a perfectly reasonable explanation sitting right next to it. They are getting older. Here is why that overlap is so dangerous. Fatigue is the #1 complaint in primary care visits for adults over 65. Cold sensitivity, feeling chilled when others are comfortable, is easy to write off as poor circulation. Unexplained weight gain gets blamed on a slowing metabolism, which is itself a real part of aging. Constipation, dry skin, thinning hair, a slightly slower pulse. Every single one of these is also a textbook symptom of an underactive thyroid. The two lists are nearly identical. The one that tends to slip past people the longest is cognitive, a modest but persistent mental fog, slower recall, a word that won't come, a general sense that your thinking is running through wet concrete. This gets filed under senior moments almost immediately, but thyroid hormone is deeply involved in neurological function. The brain is genuinely sensitive to shifts in thyroid levels. When those levels drop, thinking changes, and when levels are restored, thinking often improves, sometimes quite noticeably. So why does the thyroid tend to slow down after 60 in the first place? Several reasons, and they overlap. The gland itself can become slightly enlarged or develop benign nodules over time. The immune system, which grows less precise with age, sometimes begins attacking thyroid tissue, a condition called Hashimoto's thyroiditis, which is the leading cause of hypothyroidism in developed countries. And certain common medications, including some used for heart rhythm and blood pressure, can affect thyroid function. This is not one simple story. It is several quiet processes arriving at the same destination. The standard screening tool is a blood test called TSH, thyroid stimulating hormone. TSH is produced by the pituitary gland, and it rises when the thyroid is underperforming, essentially the pituitary turning up the volume trying to get a response. A high TSH typically signals an underactive thyroid. The test is inexpensive, widely available, and a routine physical should include it. But in practice, it sometimes gets skipped unless a patient mentions symptoms. This is the gap worth knowing about. There is also a meaningful conversation in medicine right now about what normal TSH means for an older adult. The reference ranges used by most labs were originally set using younger populations. Some researchers argue that TSH naturally drifts slightly higher with age, and that the threshold for treatment or even concern should be recalibrated accordingly. Others believe that even mildly elevated TSH warrants attention because of its downstream effects on heart health and bone density. Your doctor is the right person to interpret your specific number, but knowing the number exists is the first step. What happens when hypothyroidism is caught and addressed? Most people are treated with a synthetic thyroid hormone that restores normal levels. For a good portion of those patients, the results are not subtle. Energy improves. The stubborn way often begins to shift. The mental fog lifts, sleep deepens. These are not miracle cure stories. Thyroid treatment takes weeks to reach full effect and requires regular monitoring, but they are genuine quality of life changes that researchers have documented consistently across large patient groups. There is also a category called subclinical hypothyroidism, where the TSH is mildly elevated, but the thyroid hormones themselves are still within normal range. The symptoms here are subtler, sometimes absent. Whether to treat subclinical hypothyroidism in older adults is genuinely debated among specialists. Some research suggests treatment helps, other research finds little benefit and raises concerns about overtreating. This is exactly the kind of nuanced conversation to have with your own doctor, rather than to resolve by searching the internet at midnight. The evidence is real, the application is personal. There are also lifestyle factors worth mentioning, not because they replace a medical evaluation, but because they matter alongside one. Severe iodine deficiency can impair thyroid function, though that is rare in countries with iodized salt. Very high intake of raw cruciferous vegetables, kale, cabbage, Brussels sprouts, has a theoretical effect on thyroid activity, though the evidence suggests ordinary amounts in a balanced diet are fine for most people. Chronic sleep deprivation and persistent stress both affect the hormonal signaling that governs thyroid regulation. These are not causes of clinical hypothyroidism, but they are part of the larger picture. The broader point is this: aging genuinely does bring slower metabolism, less sharp recall, some fatigue. Nobody is arguing otherwise. The question worth sitting with is whether you have accepted a layer of symptoms as inevitable that might actually be treatable, because those two things can coexist. You can be 68 and aging well and also have a sluggish thyroid. One does not cancel the other out. Assuming all of it is simply age may mean missing the part that has a solution. If you have not had a TSH test in the last couple of years, or ever, that is worth bringing up at your next appointment, not with alarm, but with curiosity. Mention the fatigue, the cold sensitivity, the brain fog, the weight, whatever applies. Give your doctor the full picture. A single blood draw can answer a question that years of resigned acceptance could not. That is a pretty good trade for one conversation. Your energy, your clarity, your independence, they are worth advocating for.